Hello everyone. So I am back with another topic, head trauma and trauma imaging. So what is head trauma? Head trauma refers to any damage to the scalp, skull or brain which is caused by any injury. Okay. So we can see here two images, MRI and CT scan. These are the imaging techniques used in head trauma. So in trauma, just focus on one thing, which is time. It is very crucial factor in head trauma. So if you get any question regarding what is the investigation of choice in head trauma, then click or tick mark the answer CT scan. But there is one exception in which the MRI is used, that is diffuse axonal injury. So let's talk about CT interpretation protocol. In any protocol, you should always look for history of patient. This is very important. If you get the history of patient and if you get the CT scan, you have to check for bleed. If bleeding is present on CT scan, then divide it and try to judge whether it is intraaxial or extraaxial. Intraaxial means inside brain. Extraaxial means outside brain. In intraaxial, the edema is present around the bleed. So edema is present in intraaxial, but in extraaxial there is no edema. In intraaxial, you will get the hemorrhagic contusions, but in extraaxial you can see the cortical shift. I will explain you what is cortical shift here. So assume this is skull and this is brain parenchyma. Okay. So if there is extraaxial hemorrhage which is outside the brain, so this extraaxial hemorrhage will push this brain parenchyma downwards. Okay. So you can see the shift here. Okay. I hope you understand. So in extraaxial, you can see the three type of hemorrhage, which is epidural hemorrhage, subdural hemorrhage and subarachnoid hemorrhage. Epidural hemorrhage is the hemorrhage which is the collection of blood that forms between the inner surface of the skull and outer layer of the dura. Okay. And the important thing you have to remember here, the middle meningeal artery is present here. In subdural hemorrhage, bridging veins are involved. Okay. Just try to remember. As you see here, this is the image of CT scan of epidural hemorrhage. You can see on this image there is something hyperdensity, right? I will mark here. This is the hyperdensity seen on CT scan, which is convex in shape. So if you get any image with hyperdensity in the form of convex shape, then directly tick mark epidural hemorrhage. Okay, so this is right side, this is left. So you can say acute right extradural hemorrhage, and it is in acute form. Okay, in acute you will see hyper density and white in color. So the extradural hemorrhage is the collection of blood that forms between the inner surface of the skull and outer layer of dura. Okay, so in this image you can see the same hyperdensity, but the shape is something different, which is concave. Okay, so it is subdural hemorrhage. It is the type of bleed inside your head which occurs within the skull of the head but outside the actual brain tissue. And as I told you before, the important thing, bridging veins are involved. Okay, and you can see this is right side, this is left side, so you can call acute left subdural hemorrhage. So let's talk about the bleed stages on CT scan. So first of all, you have to understand, in acute there is hyperdensity and the color is white. Okay, so in this image you can see here there is something hyperdensity which is in concave shape. So it is acute subdural hemorrhage which occurs from hours to days. Clots are present, and as I told you before, it is hyperdense. The next stage is subacute subdural hemorrhage which occurs from days to week. Broken clots are present here and it is isodense. Isodense because you can see here in this image there is no hyperdensity, there is no any white color, but it is mixed type, right? It is in mixed form, white plus gray. So we can call it isodense. So it is subacute subdural hemorrhage. In third stage, you can clearly see the hemorrhage is in dark color, which is known as hypodense. Okay, so we can say it is chronic bleeding and it occurs from weeks to years, and the clear fluid is present and it is hypodense. And in chronic bleed, the investigation of choice is MRI because time is not crucial factor. Okay, so let's talk about diffuse axonal injury. Diffuse axonal injury is a form of traumatic brain injury. It happens when the brain rapidly shifts inside the skull as injury is occurring. You can see in this image there is something accident, or you can say any kind of trauma in which the brain, okay, the brain is rapidly shift inside the skull. And in this type of injury, long connecting fibers in the brain called axons are sheared as brain rapidly accelerates and deaccelerates inside the skull. Okay, so in this injury, the axons are involved. So it is known as diffuse axonal injury. Let's talk about skull fracture. As you see in this CT scan, here there is something break in skull bone, right? Also in another image, there is something break in this skull. So you can understand very clearly that it is skull fracture. So in mild break, it can cause few problems and heal over time, but in severe breaks, it can lead to complications including bleeding, brain damage, leaking of CSF, infection and seizures. And the investigation of choice in skull fracture, it is CT scan. As I told you before, it is emergency and time is important or crucial factor. Okay, so let's talk about something symptoms in head trauma. Okay, there will be loss of balance. Also, there might be head pain or neck pain. Also, there might be vision disturbances, fatigue, dizziness. These are important symptoms which you get in head trauma. So that's it for today.